Your subacute phase resistance exercises. So we'll start with TheraBand lat pull down. So obviously it's gonna work your lat muscle, right? So you're gonna start here, chest up, keep the shoulder blades down. All right, when you're looking for all these band exercises, you want to make sure you're looking from the posterior side, that they're not shrugging up when they're doing it, right? So their shoulder blades should stay down, and they shouldn't also be coming forward. So if you look from this angle, so you shouldn't see them rounding their shoulders or elevating their shoulder blades. You want the lats pulling the shoulder blades down. So this is the lat pull down with a straight arm, or you can do it with elbows bent, where it's more like you're pulling back, almost like a row. But coming up higher is gonna get the lats. And then the wide elbow version, same thing. So you're trying to pull that apex of the band with the elbows wide. All right, and we're gonna use that above so we get the shoulders going. Lawn mowers is from the bottom. So this one you can do is a one arm exercise. It's this gonna also work your lats. Okay, so we can do this one with a TheraBand. It's the easiest way. So you're gonna stagger your feet, opposite leg forward, and you're gonna pull like you're starting a lawnmower, right? So there's different variations depending on what you're going for. You can have them twist their body to get their obliques working a little bit to support. If you want to isolate those scapular muscles, your retractors, your rhomboid and your lat, then you can go with just your single arm, right? So you get the lawnmower motion. Those are working your rhomboid and lat. Chest press or chest fly is going to work your pec muscle. There's a slight variation with that. A chest press is going to involve more of your tricep because you're pressing away from your body. Anytime you do an exercise where you're pushing away from your body, it's going to incorporate your tricep. Right, so the main muscle you're working here is your pec. There's a chest press, but as you can see, I'm also getting elbow extension in there. Versus a chest fly, I'm gonna come here, and I'm gonna again isolate mostly just to that pec, coracobrachialis area, horizontal adduction. Okay, so your chest press, chest fly, right, and same thing. You're looking that they're not rounding their shoulders, they're not getting the motion with thoracic kyphosis, and or even using serratus to really push. Right, we want chest fly, horizontal adduction. All right, rows. So one of the main exercises we use in the upper extremity, work your rhomboids, right, is an endurance muscle. So mainly we use this for an endurance dosage. So you're gonna have a nice bend posture, athletic stance, chest up, squeeze the shoulder blades back, right? And we're looking for all those same compensations like we talked about with the lawn mowers or with the lat pull down. And we're not seeing the shoulders hiking. Right, when they pull back, they're not pulling those shoulders forward and rounding them more, right? So you're trying to squeeze the shoulder blades, open up the chest, right? Head in neutral, right? We also don't want to see the head popping forward, that forward head posture, right? So you're just squeezing, trying to activate the rhomboids in between the shoulder blades. So that's your classic row. We're gonna do some variations where you can add a rotation, so you can do different types of rotations here, so you can pull and then do a trunk rotation to work more of that stabilization, right? So you get isometric in the rhomboid while you do it, or you can pull and twist, one arm straight, one arm bent, right? So again, we get more of the oblique, the thoracic rotation, right? This version here, we're doing it more robotically. It's gonna be more of a hip rotation, right? Compared to single arm thoracic rotation. So it depends on if you're looking more of this exercise for lowers or uppers, you're gonna pick thoracic or hip. And then your other variation to get the rotator cuff going is you're gonna row until you're neutral, meaning the elbows even with your trunk, even on the thorax, and then you're gonna go into your shoulder external rotation, your GHJ external rotations. All right, or for the same compensations, you can do these as a high row in the 90-90 position as well, which will be a much harder progression for someone with a shoulder dysfunction or limited THJ external rotation. The classic version would be to do it down here, where you're adding that scapular control with the rotator cuff, again, watching that they're not excessively hiking those shoulder blades. Alright, resisted. Right, so then you can do your TheraBand resisted exercises in the planar motions, right? So we just have straight plane motions, like flexion and abduction. So if I'm doing flexion, I'm gonna put it at the bottom, do my straight plane thumb towards the ceiling so you don't get that impingement syndrome, right? So we don't want them doing it with the pinky up, or even if we're gonna go palm down, like if you're doing a front raise with a weight, right? Typically for a patient with shoulder dysfunction, we're just gonna have them go to about 90 degrees, maybe slightly higher. So we avoid that painful arc area of 125 to 155. If they're doing any other position, then thumb up. Right, so thumbs up, you're good to go. You can go all the way up. All right, if you're doing palm down, we're sticking somewhere below 125, and we never do an exercise with the pinky up because that's the impingement sign for the impingement position. So flexion, you're gonna do facing straight on. Abduction, you're gonna do from the side. Okay, then we have our straight external and internal. Right, so you're gonna line it up with the body, and then go in and out. I'll show you this way so you can actually see. Right, so internal, and then THJ external. Right, so these are all just straight planar motions. Bilateral extensions is the same thing as lat pull downs. Another version that some people will pick if the patient can't get through the range, if they're having trouble going through the range. Same thing, I'll show you flexion now. You can do your bilateral shoulder extensions down here, right? And so then we're just focusing on that lower trap area. It's also gonna activate your lats. But this one, now we're focusing on that lower trap area and focusing mainly on the scapular retraction phase. You can do the same thing here, working on getting the delt without the pec, right? So we don't want this where you're collapsing in and getting a lot of pec, getting a lot of rounded shoulder. We want the shoulders back and coming forward. So now we're getting more of that anterior delt, initiating with some long head of the bicep, not rounded shoulder, getting horizontal abduction. Extension, that was ER and IR at 0 with the TheraBand. Alright, so if you do it bilaterally, if you do external rotation bilaterally, we call that Brugger's. So you can put your hands through, or you can just grab the band. I'll put my hands through. Palms up towards the ceiling. So you're gonna squeeze your body with your elbows, and then push out. Squeeze your body, push out. So this exercise is called Brugger's. You can do it here at like a 0 degree of abduction. You can do it out here at a 0 degree of abduction. Then that's just called, I call these angel wings, because you're trying to, at the same time, open up and squeeze. And then you can do the same thing up here at 90 degrees of abduction. All right, same thing, focusing on not letting here, right? So a patient with a right shoulder dysfunction will look kind of like this while they're doing that exercise. From behind, you'll see them stay here and kind of flare out. Right, so you want to see that they're getting those shoulder blades down and back, setting the scap, right? That's what we call it, setting the scap, and then pushing out. All right, and those are going to be all for the scapular stabilization while activating your rotator cuff. So the main muscle we're working with those is your supra and infra. All right, so we have bilateral ER at 0, and then we got 45. All right, so we call the one at 0 Brugger's. At 45 is called don't shoot, right? Because the motion, I guess I'll keep this. The motion, if you're doing it bilateral without the TheraBand, without the wall station, you can do it just holding on or put your hands through. All right, so at 45 is this. That's what I call it, don't shoot. All right, so you want to get those Again, shoulder blades back, keeping the elbows in at a 45-degree angle of abduction, or you do the same thing here at the wall station. Some people also call these W's, because your arm is going to go back into that W position, right? Working on external rotation at 45, or around 45 degrees of shoulder abduction, and then 90-90 is the field goal position, right? So you're going up here, you want to make sure they get that rotation in the shoulders as they come back, right? That is not a Y, right? Then again, that you're going to use your all lower trap, and it's just an isometric of your supra. You want a concentric rotational component, all right? And then some other people also call it a face pull. You're just trying to pull the band right into your face. Here are wall slides, so you're going to use the wall. So the motion is that same 90 degrees at the GHJ, right? So we're using that external rotation here. You're gonna externally rotate, hold that isometric, slide up the wall, right? So I want you to notice that as I slide up the wall, my shoulder blades stay down, my head stays forward, my chin stays retracted, right? You're looking for all these factors when someone's doing an exercise like this, that they're keeping the external rotation, they're not dipping in or letting their elbow flare out. That's the classic compensation for a weak rotator cuff, is the elbow will flare out because they're basically going into internal rotation because they don't have the strength to externally rotate. So you want to make sure that they're holding that position, chin back, right? We don't see a collapse, we don't see a hike, and we don't see an elbow flare. All right, so the pinky side of the forearm stays on the wall, and you slide up and down, getting that nice serratus activation while an isometric of your external rotators while sliding up. Horizontal abduction to hit your middle trap. All right, it's gonna be here at the wall. So we're gonna do thumbs up, squeezing the shoulder blades, right? Same thing like we talked about with the row. The focus is on squeezing the shoulder blade. I could do this exercise here without really even moving my arms much, right? That's basically the same exercise. I'm going here, I'm just doing your arms basically to help your scap retract more. All right, so the focus here is on scapular retraction, not as much on that horizontal abduction component, right? Now it should be a middle trap. Dumbbell flexion, right? I got my 100-pound dumbbells right here. That's what the 1 stands for. So with the flexion, you're gonna go here, same thing, thumb towards the ceiling. You can also do palm down, but we'll never do thumb down, right? So flexion here, abduction here, we mainly keep those to 90 for the same reason that you're looking at they're not hiking. All right, if they can't lift their arm over without hiking, then you're gonna keep it down here. You're gonna lift them as they're gonna go as high as they can, keeping that posture, right? So we don't wanna see collapsing in the thoracic spine or collapsing in the cervical spine, right? Nice posture coming up. All right. Okay, you can take a break on the video.